Okay, Gene, welcome back to our Fireside Chat. I wanted to spend a little time today talking about gum disease. So the first question is, what exactly is gum disease?
Well, most people may have heard of gum disease from some other term, gingivitis, an old term, pyorrhea, which you don't hear much about that anymore, but generally on TV you'll hear gingivitis. Or if you want to use a more technical term, periodontitis, periodontal disease, but gum disease, gingivitis is probably the most common.
Essentially, what does all that mean?
It means infection. Itis means inflammation, so you've got inflammation of the gums. And the cause of that inflammation is from a bacterial infection. So there's an actual infection in the gum tissue.
So why would I be concerned about having gum disease?
Well, first, let's start with the initial concerns with gum disease were eventual bone loss and loss of teeth. So that will then result in poor mastication or chewing and affecting your digestion. So our parents or grandparents, you may remember, had dentures, and so they were. You heard the term gumming their food. So that's so the health issue there is that it's affecting the digestion of it. So gum disease leads to tooth loss. Currently, now in the medical community, it's well accepted from numerous studies that this infection that's in the gums immediately will inoculate the bloodstream. So now we have certain health issues that were not so much of a concern before in terms of losing teeth, but now the risk of heart attack, stroke, and diabetes, and even some cancers.
So you're suggesting that the bacteria that are causing this inflammation and infection in the gums actually will get in the bloodstream.
Absolutely.
And affect other organs.
Other organs. Yeah.
Okay, that's pretty scary stuff.
Yeah. The major cause of all disease is inflammation. And the primary cause of inflammation, or the number one cause of inflammation, is infection.
Right.
So, and the medical community has missed the boat on this. Because any other infection in the body, they're alarmed. They want to put you on antibiotics. They want to put you in the hospital, put you on IVs. But here we got this insidious infection in the mouth that's not only potentially causing the loss of teeth, but potentially causing death.
Right. So our real message here today isn't simply that you need to brush your teeth and floss and take care of your mouth so you don't get gum disease, but if you've got gum disease, you need to be really concerned.
Absolutely.
Okay.
Yes, this could be the missing link to so many deaths in this country that, especially someone dying at a much younger age than ever considered, 45 years old, having a heart attack and dying, and no known cause. No known cause. Are we missing the boat on not really looking at the mouth? As in Chinese medicine, they'll say 90% of all disease is somehow related or correlated to the mouth.
Interesting. So how would I know if I've got gum disease? Is there any way that I can tell?
You may, if you're fairly educated and aware and paying attention, that maybe when you're flossing or brushing, you may get some minor bleeding, or you rinse out, there's blood in the sink, But believe it or not, some people think that's normal. I've had patients come in and I thought it was normal for my gums to bleed. It's so it's just lack of education.
Right.
If you thought about any other part of your body, and if you were to scratch your skin and it started to bleed, you'd be concerned.
Right.
Or if you had a nosebleed that you couldn't stop, they'd rush you to the emergency room.
Right.
So bleeding gums are not taken that serious. A nosebleed is a serious problem also, but it's probably not going to lead to potential cardiovascular problems or diabetes or even death.
So what you're saying is bleeding gums should be taken seriously.
Absolutely.
Right. We shouldn't just gloss over it and say, well, that's just a sign of aging or, natural occurrence.
Yeah, because they might bleed occasionally. Maybe they're not bleeding all the time. I'm not having any pain or discomfort from it. I go to the dentist. They clean them. They say you get a little bit of bleeding. Don't worry about it. Use some mouth rinse. Maybe floss them more often.
Right. Yeah. So other than bleeding, how else would I know?
Well, if you got to an advanced stage, you may start to notice that your teeth are loose. You could or could not experience some pain, depending on whether you developed an acute abscess infection that could create some swelling, facial swelling, and some severe pain. Otherwise, you might not know. I had a patient just a couple weeks ago who called for an initial evaluation and said that her teeth were loose.
Right.
Within the 2-week time from the time she called to the time she showed up, one of the teeth had actually fallen out.
Oh, my.
So a tooth actually fell out of her mouth. She had no discomfort, no pain associated with it.
Yeah.
She was more concerned that her teeth were loose.
So of those 85% of the population that has gum disease, one of the things that I read is that most people don't even know that they have it.
Well, it's usually a slow progressing disease. And I said even in the advanced stage, you still may not know.
Right.
This woman was not aware, and if you had asked her, do you have gum disease, she would have said no. My teeth are a little bit loose, but no, I don't have gum disease.
Yeah.
So she clearly has some other things going on for her teeth to be that advanced that they can actually fall out.
So one of the underlying messages we really want to get across here is the importance of recognizing that you probably do have gum disease and that it's serious.
Yeah, more than likely, if the studies show that 85% of the population, are you one of those, or are you one of the 15%?
15%. Not very good odds.
Not very good odds. And if you consider that may be a link to heart attack or stroke or diabetes, and you have a family history of that, I mean, I'd be alarmed.
Right.
Especially when there's something you can do to prevent it.
Exactly. So the question then is, if I can't tell that I have gum disease, how would my dentist be able to tell?
Well, standard treatment or protocol would be looking at the gum tissue. Is it red or is it pink? Is it puffy or is it tight against the tissue? Does it have a gloss or is it, shiny or is it pale? Those would be the initial observations. Then you may start to do some probing to determine what the pocket depths, and that's actually trying to determine how much disease process going on.
Pocket being where the gums kind of surround the tooth.
The gum surrounds the tooth and it attaches to the tooth.
Okay.
So the more the gum becomes detached, the larger the pocket will
I
be.
see.
So that may give you some signs based on the depth of that pocket. But also clearly often happens is when you're probing those pockets, you'll see some bleeding occur.
I see.
Now it may be some slight bleeding, it could be some heavy bleeding, maybe spontaneous bleeding. So all those are indicators there's something, some kind of disease process going on. But that's a standard.
Right.
So they're going to then make some determination based on that, on what level could be mild, moderate, or severe gum disease.
What would my dentist do to treat the gum disease?
Probably put you on some type of program that might initially be, doing some what they call scaling and root planing, where they're actually removing the buildup of tartar or calculus, we call it. It's just that really it's just hardened or calcified plaque that's been on there. So they're going to start with that. Just like any other irritation, you have to remove that. If you had a splinter in your hand, you'd have to remove that to remove the irritation and the inflammation. So they have to remove that. It's also a great source for bacteria to feed off of. So until that's removed, you're not going to get any healing to occur. So that would be typical. Then they probably would recommend some oral rinses, maybe some antibacterial, antiseptic rinses. Encourage you to brush and floss more. They may give you some other types of instruments that might help you with that, some other tools. May recommend a water irrigator or an electric toothbrush, something to help you at home to help keep that buildup down.
Right. And as I understand, also they would often recommend surgery in this process.
If it's advanced enough, then yes, they're going to recommend, and after doing this initial therapy of scaling and debriding and root planing, they're going to probably do some surgery to get down into those pockets. Maybe even eliminate those pockets by cutting some of the gum tissue away, which then would allow you to be able to clean it better. But it's not getting at the root cause of the problem.
I understand. So you've mentioned standard dentistry, the standard approach a couple of times here. What's different about your approach?
Well, I've had all that training, and over the years, it really didn't make sense to me to continue to maintain and help patients maintain their disease. So if they went through this process without looking at the root cause of the problem, looking at the connection systemically, because there is a bidirectional effect here. Mm-hmm. Gum disease contributing to diabetes, but someone who's also diabetic is probably going to have gum disease.
Gotcha.
So our approach is let's look at, also start with that initial therapy, but let's also look at what's causing it. And the first thing we're going to do is we're going to take a sample of your plaque and look under a microscope.
Mm-hmm.
And under a microscope, we're going to look for certain types of bacteria. It might be spirochetes, it may be amoeba. These sorts of things are not normal in a healthy mouth.
I see.
So you also may see lots of numbers and lots of motility. So these are going to give us a better idea of what the health of the patient is.
Okay. So that's, we might say, actually a more objective way of assessing whether you have gum disease than just looking and seeing whether it's bleeding or not, or it's a more objective approach.
Well, because bleeding in itself could be from other causes. I mean,
Right.
especially today with so many patients on blood thinners.
Mm-hmm.
It could be, from pregnancy. It could be from other medications. It could be from vitamin C deficiency or B deficiency, or some kind of blood disorder. So if we just say from bleeding they automatically have gum disease, then we could be improperly diagnosing this
Right.
situation.
Right. So this looking at it through a microscope then also gives you a way of assessing how to proceed with treatment and whether the treatment is being effective.
Right. So it gives us a good baseline where you are today, and then upon initiating treatment, which includes the treatment in the office and then what you're going to do at home, we can reassess it and see if it's improving, is it changing, is it getting worse. Hopefully it's not getting worse, but we can, at some point in time, make an assessment that you now have healthy gum tissue. Because we're not finding these spirochetes, we're not finding these other bacteria, we're not finding things that would not normally grow in the mouth.
Yeah. So other than using the microscope as an assessment tool, what else differentiates you? How else are you different?
Well, there are other diagnostic tools that aren't standardly used in the dental office. We could take a fluid sample around the gum tissue and send it off to a lab. That's going to be able to identify those specific bacteria, which I'm not a microbiologist, so I can't tell you what all those bugs are on there.
Right.
I can just say those aren't normal.
Right.
So we could find out exactly what it is, especially if we have a difficult case where they just don't seem to be getting better. We may want to identify the specific bug, and in some cases, as much as I dislike it, I will prescribe an antibiotic on a short-term basis to reduce or get rid of that bacteria to allow the normal healing to occur.
Right.
We can also check DNA with that sample to see if this particular patient is susceptible from a genetic perspective to periodontal disease.
Okay. And as a biological dentist, again, you're looking more at the whole system rather than just focusing on the mouth.
Right, we're concerned with the overall health of our patients. I mean, don't get me wrong, I'm concerned that patients might lose their teeth. I'm concerned that they need their teeth to chew properly. There's a lot of things that are involved in a healthy mouth, but I'm more concerned about their overall health, especially when we're talking about systemic problems like heart attack and stroke and diabetes. I mean, heart disease is now the #1 killer. So if we have some association between the #1 killer and it's something that dentists can become involved in and intervene in this potential life-threatening disease, then we need to be doing that.
Right, right. And part of that approach also is nutritional. You look at, if we're talking about infection, then we need to also be talking about the immune system.
Correct. So we also look at, and that's where we take a perspective of how's the host doing?
Right.
How is the host allowing this to happen? What's the environment? What's the status of the immune system that's allowing these bugs to proliferate, to grow, and they're not going to grow unless the system is unhealthy.
Right.
So what can we do to support that? And we're going to look at lifestyle, we're going to look at diet, look at stress, look at supplementation, where there are deficiencies. So we're going to do all those things to help them boost that up. You know, one of the things we recommend is that patients initially do their pH so they can measure where the body is in terms of alkalinity versus acidity. Because we know in a more acidic environment, that's more conducive to disease process.
Right. So pH is just something that they assess rather easily in terms of urine or saliva.
You can check saliva pH. You know, if it's acidic, you're going to be more susceptible to decay. Right. If your urine pH is acidic, you're going to be more susceptible to disease, including gum disease. I mean, gum disease is a connective tissue disease.
Right.
It's no different than any other connective tissue disease in the body. So why are we ignoring it?
Mm-hmm. So what I hear you saying then is that gum disease is a central concern that almost everyone should have about their health, and that your approach is a more comprehensive approach, that you look at it more comprehensively, more broadly than a traditional dentist might do.
Yeah, if we take into consideration in Chinese medicine that they make the statement that 90% of all disease is caused by poor oral health, or somehow contributed by the oral cavity.
Interesting.
If we were to take that approach, that would be a whole different perspective on helping patients who suffer from cardiovascular disease or diabetes of unknown origin. They identify it as idiopathic. Yes. Meaning we just don't know.
Yeah.
But they haven't taken into consideration that the patient may have, gum disease or some other oral health problem. I mean, that's not a standard of practice in the medical field.
Right. So we could actually say this is really a missing factor in both the medical field and the dental field.
Absolutely. I think it's clearly the link between medicine and dentistry, and dentistry being that missing link that may answer a lot of those questions of why patients die at a young age of unknown factors.
Right.
We've all experienced friends or family at 45 years old suddenly dies of a heart attack of unknown origin.
Sure. So, Gene, is there anything that I can do to help with my gums, to avoid problems in the future?
Well, ideally would be that you found a biological dentist who's taken the same approach, so that you have some baseline. They can take a sample,
with the
microscope. But let's say you don't have that, and your dentist is just going to do standard protocol. You've got to take some active responsibility here, and you've got to be able to maintain your oral health by being diligent with whatever you need to, whatever it takes, whatever antibacterial rinses, whatever, floss, water irrigators, whatever it is. But you also got to look at what you're doing in terms of your lifestyle, because we know there's certain risk factors: smoking, alcohol, stress, dietary. So it really is a whole body approach.
Good. Well, this has been very informative. Is there anything else you'd like to say in closing?
Well, I just said, we need to get the word out. People need to be aware. If you're concerned about your friends and family and your own health, get your mouth checked. Make sure that you're finding out whatever you need to do to get this gum problems under control. Good. Unless you're one of those 15%.
That's right. Well, even then.
Then you want to make sure you're maintaining it.
That's right. Yeah. So go tell your friends. Okay, tell them to go watch this video. Tell them to get a biological dentist and get their mouths taken care of.
Absolutely.
Very good. Thank you for our little fireside chat here, and look forward to our next one.
Great. Thanks for having me.
Very
Excellent.
Good. Thank you. We'll let you know.